The webinar will begin soon. Please stand by. The webinar will begin soon. Please stand by. Good afternoon. I'm Laura Morell, and I work in the National Center for Emerging and Zoonotic Infectious Diseases at the Centers for Disease Control and Prevention. On behalf of CDC's One Health Office, I'm pleased to welcome you to the monthly Zoonoses and One Health Updates call on February 2nd, 2022. Next slide, please. Although the content of this webinar is directed to veterinarians, physicians, epidemiologists, and related public health professionals in federal, state, and local positions, the CDC has no control over who participates. Therefore, please exercise discretion on sensitive content and material, as confidentiality cannot be guaranteed. Today's webinar is being recorded. If you have any objections, you may disconnect now. Links to resources from each presentation are available on our website at cdc.gov/onehealth/2022/february.html. Next slide. Today's presentations will address one or more of the following 5 objectives. Describe 2 key points from each presentation. Describe how a multi-sectoral One Health approach can be applied to the presentation topics. Identify an implication for animal and human health. Identify a One Health approach strategy for prevention, detection, or response to public health threats. And identify 2 new resources from CDC partners. Next slide. In compliance with continuing education requirements, all presenters must disclose any financial or other associations with the manufacturers, commercial products, suppliers of commercial services, or commercial supporters, as well as any use of unlabeled products or products under investigational use. CDC, our planners, presenters, and their spouses and partners wish to disclose they have no financial interests or other relationships with the manufacturers of commercial products, suppliers of commercial services, or commercial supporters. The Planning Committee reviewed content to ensure there is no bias. The presentations will not include any discussion of the unlabeled use of a product or a product under investigational use. CDC did not accept commercial support for this activity. Next slide. Instructions for receiving free continuing education are available at cdc.gov/onehealth/ZOHU/continuing education. The course access code is ZOHU Webcast. To receive free CE for today's webcast, complete the evaluation at cdc.gov/TCE online by March 7th, 2022. A captioned video of today's webinar will be posted at cdc.gov/onehealth/ZOHU/2022/february.html within 30 days. To receive free CE for the web on-demand video of today's webinar, complete the evaluation at cdc.gov/TCE online by March 8th, 2024. Next slide, please. Before we begin today's presentations, Dr. Colin Basler, Deputy Director of the One Health Office, will share some news and updates. You may begin when you're ready.
Thanks, Laura. Hello, everyone. Welcome to the first ZOHU Call webinar of 2022. We appreciate you all joining us today. Before our presentations begin, I'd like to share some updates with you all. You can find links to these resources in today's ZOHU Call email newsletter. If you aren't yet subscribed, please use the link at the top of the main ZOHU Call webpage. Our response to the COVID-19 pandemic continues to evolve. Please check CDC's website for the latest guidance and resources, including information about keeping people as well as animals safe and healthy. Next slide, please. There is no evidence that animals are playing a significant role in spreading COVID-19 to people, but we continue to see animals reported with SARS-CoV-2. In the United States, 346 companion and captive animals have been reported, including cats, dogs, ferrets, hyenas, large cats in zoos and sanctuaries, a binturong, a fishing cat, a coatimundi, otters, and gorillas, as well as white-tailed deer and mink. 17 mink farms have been affected by SARS-CoV-2 in the US to date. The latest animal case numbers are available on the USDA APHIS website. Guidance for pet owners, mink farmers, veterinarians, and many others are available on CDC's website. Based on the identification of SARS-CoV-2 in white-tailed deer in multiple states, CDC recently updated our recommendations for hunters and other individuals who have regular contact with wildlife. Next slide. You'll find links in today's newsletters to several recent publications, including an outbreak of multi-drug resistant Salmonella Heidelberg infections linked to dairy calf exposure in the United States, and an evaluating of public acceptability of a potential Lyme disease vaccine using a population-based cross-sectional survey in high incidence areas of the United States. Next slide, please. We've also shared links to several recent announcements, including 2 about recent highly pathogenic avian influenza H5N1 infections in wild birds, and the Interagency Food Safety Analytics Collaboration, or IFSAC, 2022-2023 Interim Strategic Plan. Next slide, please. Some upcoming interest include the One Health and Development for a World Under Pressure Symposium in May, and the International Conference on Emerging and Infectious Diseases, or ICEID, which has been rescheduled to August 7th through 10th in Atlanta. Next slide. And finally, there is a new Salmonella outbreak linked to pet bearded dragons, an E. coli outbreak linked to packaged salads, and 2 Listeria outbreaks also linked to packaged salads. Please visit CDC's Healthy Pets, Healthy People website for a selected list of ongoing and past US outbreaks of zoonotic diseases. We appreciate you sharing the ZOHU Call website link with your colleagues from the human, animal, plant, and environmental health sectors, and letting them know about the live webinars, video recordings, and free continuing education. Our next call will take place on March 2nd, 2022. Please send presenter and topic suggestions for future as well as news from your organizations to zohucall@cdc.gov. Now I'll turn the call back over to Laura.
Thank you. Next slide. You may submit questions at any time using Zoom's Q&A feature. Please include the topic or presenter's name. The Q&A session will follow the final presentation if time permits. You can also email questions to today's presenters. We've included their email addresses on this slide, on the ZOHU Call webpage for today's webinar, and in today's email newsletter. Next slide, please. Our first presentation, Factors Influencing Distribution of Coccidioides, Immedus in Soil, Washington State, 2016, is by Dr. Nancy Chow. Please begin when you're ready.
Thanks, Laura. Appreciate that. Hi, everyone. It's good to be here. I think I only have 12 minutes, so I'm going to try to be speedy. But first and foremost, thanks for taking the time to hear about fungi and fungal diseases. This work that I'm about to talk about started way back when in 2016, has really spanned over the last few years, and we started to communicate the findings this past year. So excited to share. Next slide. Thanks. So first, Coccidio what? That's often the sentiment we get, people asking, how do I pronounce this? What is this? So Coccidioides, it's a fungal pathogen. This genus has 2 species, one called Coccidioides immedus and the other Coccidioides placidacei. Now, clinically for disease, these 2 species present the same. So disease presentation is not different, but there is geographic variability between these 2 species. Next slide. And in terms of disease, what we're talking about here is coccidioidomycosis, sometimes called valley fever. So for those online who've heard of this before, if you have, it's probably by the name of valley fever. We know that infections are primarily caused by environmental exposures. Coccidioides lives and grows in the soil, and that soil, when it's disrupted, it can become airborne. So the Coccidioides spores, sometimes arthroconidia, that can become aerosolized. And if you breathe that in, you can maybe get an infection, a pulmonary infection. Next slide. And in terms of clinical presentation, we see a wide variety. So about 60% of persons infected will be asymptomatic. So they won't have symptoms, they won't know they're infected most often, and go on to clear the infection in a matter of weeks or months. The remainder, the other 40%, they are symptomatic, and this often presents as a community-acquired pneumonia. So you can have a persistent cough, difficulty breathing, extreme fatigue, fever. These are the common symptoms that we hear being reported. But this particular point, we often like to say that in terms of education and communication efforts, a lot of work goes here because cocci is often misdiagnosed as a bacterial infection, and persons are sometimes put on antibiotics. And really, it's a fungal infection that needs antifungals. So that's something that we really try to communicate out and really respond to with robust education efforts. And then lastly, it is rare, but some go on about 1% to develop a disseminated infection. And this is if the Coccidioides spreads from the lungs, it can go to the bones, maybe the meninges, and this is often life-threatening. Next slide, please. So mapping valley fever, understanding where it is in the environment, understanding where infections are having, so having surveillance. This is a lot of what we do in public health. So on the left, you're looking at slides thinking of its typical endemicity. Where is cocci in the environment? We know that it's in parts of northern, central, South America, in the United States, primarily in the southwestern part. We've seen it start to go up further, that we've realized that it's further. So as far up as northern Utah. That happened in the early 2000s where there was an outbreak of valley fever among workers at an archaeological dig site. We went back, we sampled, and cocci was identified there. The most recent place, so about 15 years later, it was identified in Washington State. And I'm going to tell you a lot more about that. And then on the right, you're looking at average incidence rates, and you can see that the majority of the burden, or the most burdensome places, is Southern California and Arizona. Next slide. So to get these maps, there's a lot of data that feeds into it. But recently, we've done a lot of modeling, a lot of people, and by we, I mean the valley fever community, in terms of predictive modeling and really trying to understand where is the endemic area of cocci, what is the geographic distribution of cocci in the United States, and what's going to be the impact of climate change in terms of thinking of intensified dust storms or other sort of extreme weather events, or mean annual temperature rises. When thinking 100 years out from now, what is it going to look like? And we've made a lot of progress in this area, but thinking about where we have left to go, this gets to the next slide. What is the public health gap, and how are we addressing that gap? So in terms of the gap, what we've noticed is that there's limited environmental data. We're talking about deep, comprehensive data at local sites that can be used to inform the parameters of these types of models. Now, because of the limitations and the lack, it can sometimes lead to overfit models and inaccurate conclusions. So for this work, what really our main objective was to pick a site and really try to collect some deep, comprehensive environmental data, including the metadata, really look at some particular questions in mind, and have that data be able to inform the types of models that we want to do more of. Next slide, please. And then I think you can just go to the next slide. Thanks. So methods, what did we do? We took a study site and we focused on Washington, particularly an ATV park, so an all-terrain vehicle. I have never ridden one of these, so I'm not going to pretend to be familiar, but this is an ATV park where we knew Coccidioides was documented. The story behind this was a 15-year-old male case riding their ATV, fell off, injured their leg. A few weeks later, Coccidioides is growing from the leg wound. And because he knew exactly where he fell off, officials could go back, sample that area, and cocci was identified. Next slide. And so what we wanted to do by taking this study site, we wanted to think about certain variables. And we wanted to see whether or not there was a correlation between cocci colonization and certain things like being on the trail, being near a wash. So that would be a proxy for some sort of water activity. There's a wash in this area. We wanted to look at rodent activity. There is a big theory in the valley fever community about whether or not cocci requires a mammalian host to propagate and really spread in the environment. So we wanted to look at that if we could. We wanted to look at vegetation and, very importantly, soil composition. So thinking about chemical and microbial signatures. Next slide. And then to do that, how do we actually capture all these variables? How do we get enough sample size? We had to think of our sampling design. And I could go on a lot about this, but we thought of every different shape, circles, ovals, squares. We thought of grids. We learned so much about transects and how you can sample along gradient of interest. We read a lot of interesting studies. Next slide. But this is what we sort of decided on after taking all of kind of the lit reviews and talking to experts in the field. So we thought of a radial design where the center would be where we knew that ATV accident happened and we knew it to be cocci positive. And we started to radiate outwards. For the first 10 meters, we'd radiate out each meter. And then after that, in increments of 10 meters until you got out to 100 meters. In this design, we had 9 transects. And so we would sample through that transect every 10 meters. So where you see a white square, that's where we sampled. We took a 1 square meter plot and we sampled to the left and to the right. For each square meter plot, we dug 3 holes about 10 to 15 centimeters below the surface, took that soil, and then we composited all 3 of those digs into 1 sample. And then whenever we hit a rodent hole that lied within that 1 square meter plot, we would sample that rodent hole. So that was an additional sample. Next slide. And this, this goes without saying, this was a lot of work, a lot of effort from the Washington State Department of Health, CDC colleagues. We collected 281 samples. You can see us here in our intense PPE equipment, trying to avoid infection, trying to get out there and measure the different angles to get the transects. For the spatulas that we used, we would rinse, bleach, rinse each time we dug. We did pH measurements, altitude measurements. We were recording all of these things. So a lot of work went into this, a lot of kudos to a lot of people. And next slide. And then, oh yeah, so the fun really began when we got the samples back to CDC and it was processing time. So first we did the molecular route. So we extracted DNA from all samples. We developed a single tube nested qPCR assay to really sort of increase the sensitivity for environmental detection. And that way we could say, okay, this soil sample is positive, this soil sample is negative. The next thing we did in collaboration with USGS, the US Geological Survey, is we did leaching soil, and this was to look at chemical analyses. And leaching, really what it was that we did is we took the soil, added it to distilled water, you shake that up, and then you let the soil and the sediment sort of settle down. But that water that remains, that's your leachate now. And you can go on to do all sorts of analyses, ion chromatography, plasma mass spectrometry. We looked at organic carbon, all of these things to look at ions, trace elements, and all of that was in collaboration with USGS. And then next slide. So what did we find? What were the results? Next slide. First, we found that there was a wide distribution of Coccidioides Immedus, that was the species here, at this site. So everything that you see in red was qPCR positive. And you might notice the addition of circles. Those were actually, when we got to that square meter plot, if there was a rodent hole, we sampled, and that's what the circle represents. We noticed that the highest positivity rates were about, within 30 meters from the center, with the highest concentration in the gully/wash area. And then I think this is kind of getting cut off a little bit, but what we did is we took the samples that were positive for cocci by qPCR and we cultured them, and we tried to culture them for cocci. That can be really hard. So not all samples got an isolate, but for some we did, and we were able to perform whole genome sequencing, and we looked to see whether or not they were phylogenetically similar, whether genetically in terms of diversity, whether they were similar to clinical and environmental isolates elsewhere in Washington. And they were. You can see that they kind of have their own clade here. And they're very genetically distinct from isolates in the environment and clinically from California, kind of the other sort of clusters that you're seeing. And so this kind of spoke to the fact that this introduction of Cocci into Washington, it's not recent. Cocci had been there for a while. That's what this supports. Next slide. And then in terms of the factors that we were interested in terms of the transect, distance, pH, rodent, vegetation, this is kind of what we saw. Again, the closer you were to the center, the more likely that sample was to be Cocci positive or colonized by Cocci. We saw an inverse correlation with vegetation. So less vegetation, more likely Cocci positive. And this really complemented with the ATV track, where that correlated with Cocci positivity. And that kind of makes sense because you would imagine that being along the ATV track, and that's what we saw, you saw less vegetation. Next slide. Thanks. And we did want to highlight this was a little bit of a surprise to us because again, in the community, there's this big theory about rodent activity, rodents being needed, but we didn't see a correlation. Now, this is one data point, so just something to consider, but this was a bit of a surprise to us. And then next slide. In terms of chemical signatures, we looked at over 60 trace elements, lots of ions, dissolved organic carbon, but just highlighting a few here. What we saw is that elevated levels of boron, calcium, magnesium, sodium, and silicon, they were correlated with Cocci colonization. Probably the least surprising was sodium, just because we know that Cocci likes high salinity environments. We actually use salt when trying to culture it in the lab. So that was maybe the least surprising. And then the most surprising was silicon. That had not been seen really before when you look in the literature. Next slide. And then in terms of microbial differences, I forgot to mention that when we extracted that DNA and we were doing qPCRs, we also used that genomic DNA to do metagenomics, specifically amplicon sequencing, looking at ITS. And what we found were significant differences in terms of the microbial profile. And I guess I'll just note that for certain genera like Curvularia, that's known to associate with plant and decaying plant material, that was inversely correlated with Cocci positivity. And that kind of, again, made sense what we saw with the inverse correlation with vegetation and the ATV track. So it's nice when things make sense. Next slide. And then, just to get into limitations, I guess the beauty of this study in some ways is its limitation. We picked one site and we really wanted to do it well and really collect a lot of data from that. But at the end of the day, it's one site. And so when thinking back to that map of where Cocci is found and thinking about other geographic areas where this type of work could be done, that would be helpful. This is only one species, just C. Immedus. Would it have been different if we'd been looking at C. Coccidioides site? Maybe. And then there's no temporal data here, so we can't think about the effects of precipitation or temperature changes throughout the course of a year and how that affected colonization. Next slide. And then, I won't go into all of the conclusions, but just to say that given the objective of this work, this is what we're trying to do now, where we're taking this data and we're really talking to a lot of subject matter experts who do predictive modeling, who can build these maps and try to bring in this data to help inform some of those parameters. So that's what we're actively doing right now. And then I think the next slide is acknowledgments. Just giving a big thanks to Washington State Department of Health, especially Dave Kangser. He was definitely the implementer in terms of the actual sample collection and figuring out how to do these transects. Suzette Mormon and Jeff Plumley at USGS, and then many folks at CDC. Special thanks to Lalitha Gade and Anna Litvintseva. And then I think the last slide is just what we often say to say thank you. And you can go to the last slide if it's there, but it's just saying think fungus save lives. And then I will end. I think Q&A is afterwards.
Thank you, Dr. Chow. Next slide, please. Our next presentation, Meliodosis, a potential zoonotic disease, is by Dr. William Bauer. Please begin when you're ready.
Yes, thank you. And I just wanted to thank everyone for joining us this afternoon. And I will go over meliodosis, as it may be a potential zoonotic disease next. So just a quick overview. So I'll go over the meliodosis background, since it's not normally thought of a zoonotic disease. So I'll just give a little background to people who may not be familiar with it. Then I will go over the case that we investigated that may suggest that it has a zoonotic component. And then actually I have Q&A here, but as has been said, we will do Q&A after all the presentations. Next. Okay, next. So meliodosis is caused by the organism Bulgaria pseudomallii, and it is a gram-negative bacillus, and it is in the environment. It's usually found in soil, and it's a we talk about it as an opportunistic infection because most people who get it have some underlying condition, and it can last in host cells for a period of time, such that you can have a subclinical infection, and then many years later it can recur. And some people may have heard of it. It's called a Vietnam time bomb, where U.S. soldiers had been in Southeast Asia, where it is endemic, and would come back in years later, develop meliodosis. And it does cause disease in both humans and animals, but there's not a lot of evidence of transmission from animals to humans. And just one other significant thing about it is that it is considered a select agent because it does cause severe disease. The inoculum for causing disease is fairly low, and it had been developed as a bioweapon by some countries before the ban on development of bioweapons was instituted in the mid 1970s. Next. So meliodosis, also known as Whitmore's disease, it can have several clinical presentations, and it is also given the name the great mimicker because it can present as in several different forms. Oftentimes develops as a cutaneous lesion. Pneumonia is often confused with TB. You can present with just bacteremia and sepsis. It tends to cause organ abscesses, so microabscesses in organs, and there is a neurological component to it. There are specific strains of Bulgaria pseudomallii that have a propensity to cross the blood-brain barrier and cause a meningoencephalitis. Risk factors, as you can see there, a lot of the cases are in people who have pre-existing conditions such as diabetes, excessive alcohol use, chronic lung disease, liver renal disease, and also other things that cause an immunosuppressing condition. However, it is not necessarily related to HIV, but then about 20 to 30% of people who are acutely infected have none of these risk factors. Next. So transmission occurs basically on how the organism enters the body. Because it's in water and soil, it can come through the skin, through wounds, or just microabrasions in the skin. It can be ingested, And then one of the more concerning ways of getting it is through inhalation, where it causes a severe pneumonia. And this is often associated with weather events that the organism is blown by driving winds or waters and aerosolized and inhaled. There is very limited history of human-to-human transmission, like just a handful of case reports, and is not thought to be a vector-borne disease. But it is an occupational hazard in that people who work in micro labs. It is known to be a lab-acquired infection just because, as I previously said, it has a low inoculum to cause disease, and it can be aerosolized off of a plate just by the normal handling of a plate growing the organism in the lab. Next. Again, just the clinical forms. We don't necessarily need to go over this. I think I covered this previously, that acute pneumonia is one of the most common presentations, but then they have localized skin infections. It can disseminate and cause a fulminant septicemia. And then I did talk a little bit about a particular strain that does have a propensity to cause neurological disease. Next. So here is just sort of a map of where we believe meliodosis is endemic. It is sort of known as a tropical, subtropical disease, particularly in Southeast Asia. You can see that Northern Australia and Asia and Southeast Asia and South Asia, India is particularly hotspots for meliodosis, and then in South America and Brazil. And as you'll note that there is, in the US, it is not thought that it is endemic in the continental United States. However, there have been some soil isolates found in Puerto Rico. Next. So now I'm going to talk about a potential zoonotic case that we investigated. Next. So the case was a 56-year-old Maryland resident who had a history of diabetes, rheumatoid arthritis, and had a history of using tobacco products. So she did definitely have some risk factors for acquiring meliodosis. So she had a 2-day history of her respiratory symptoms, went to a healthcare facility, was diagnosed with community-acquired pneumonia and discharged and returned being sicker, and was hospitalized and treated and eventually recovered. And as part of our workup, they drew blood cultures, and the CDC was notified by the Maryland Department of Health that there was a presumptive Orchidaria pseudomallei isolate from the blood, and the our zoonotic and select agent laboratory confirmed the diagnosis of or confirmed the identification of Orchidaria pseudomallei, and the whole genome sequencing suggested that it originated from Southeast Asia, which is often what we see, that people who are infected in the United States, when you do the whole genome sequencing, it sort of points to a region of the world where that organism likely was from, and then you do an investigation and you talk to them and they say, oh yeah, I was in that area of the world in some period of time in the past. Next. So, but interestingly, when Maryland Department of Health interviewed the patient, she had no international travel history. Basically, you can see there that she had traveled, been in Florida, South Carolina, Pennsylvania, Massachusetts, and that was the extent of her travel from Maryland. She had several pets that she had over the years, but none of those were current. She worked as a beautician, but was disabled because of her rheumatoid arthritis. And you can see that the people in her household had jobs as landscapers and fishermen. Next. So the goal of our investigation was to, find the source of this infection. So, we knew that she didn't have any travel history, and it looked like this organism had originated from Southeast Asia. So we wanted to collect items in her home that could be tested to see if it had been contaminated with Bulgaria pseudomallei. We have often thought that that was the case, that some cases could be occurring in the United States that were exposed to a product that had been imported from an endemic country, but we had yet to definitively show that. So we worked with the Minnesota Department of Health to guide them on home sampling. And during the investigation, it turned out that she had 2 fish tanks, and we said, yes, please collect some samples from those fish tanks. And those samples were sent to our zoonotic and special or select agent laboratory for testing. Next. So we got 23 samples, and we put them in special incubation or enrichment broth to enhance the recovery of Bulgaria pseudomallei. If it was there, you can see the samples there that we collected, and there were 2 water samples, and some of those 11 environmental samples were from the fish tank, but at the time we didn't know, so we collected samples from vaping products and from oils that look like they may have originated from Southeast Asia, and also some soil samples from around the property. And we did find culture and DNA positive results from water from the fish tank and 2 swabs from one of the fish tanks. Next. And this is just a dendrogram to show that the swabs and the water from the fish tank and the isolate from the patient were an exact match, suggesting strongly that she was infected from interaction with the aquarium. Next. So after we got this piece of information, we went back and talked to the patient some more, and found out that she had purchased 2 fancy guppies in July 2019. They died 4 weeks after, or 4 weeks prior to onset, and she had cleaned the tank out with bare hands when the fish died. And no one else in the house really had contact with this. It's not on the slide, but she did note that she had 2 fish tanks, fish tank 1 and 2. Fish tank 1 had no positive samples, but she did say that fish tank number 2 tended to be cloudy and require more cleaning than tank 1 prior to the death of the guppies. And there's a timeline there that you can sort of see where they got the fish died, she cleaned it out and became sick. Next. So we worked with Maryland Department of Health and identified a national pet retailer where she had purchased the guppies. And the national retailer was very cooperative in the investigation and allowed us to take samples from aquariums and talk to staff members, and 8 of 12 staff members who had high risk, essentially they were the ones who worked with the fish, gave us serum samples. And all the samples taken from the aquariums were negative, and all the serum samples from the employees indicated that they had not been exposed to Bulgaria pseudomallei. And since we don't believe that it's endemic in the United States, that you would not expect someone to have a serological response to Bulgaria pseudomallei. Next. So in talking with the pet store, we found where they got the fish and the plants that were in these aquariums, and they said about 99% of their guppies came from one supplier in Los Angeles County, and 100% of the plants came from another supplier in Los Angeles County. And these suppliers all source their fish from Southeast Asia and which would match where the isolate in the patient came from. Next. Next. Okay, so we then we worked with Los Angeles County Department of Health and actually had an EPA to investigate the two vendors. So, and as I said, we found out that supplier A supplied like 99% of the guppies and other species to the this national chain, and supplier B, the majority of the aquatic plants. So we took 214 samples that included transport water from 31 different farms in Southeast Asia, the aquarium water swabs from transport water trays and from the facility drains and transport media, including plant material. And we also took fish carcasses that arrived dead as they were brought into the or into the vendor in Los Angeles. Next. So we did find that the transport water from one location in Sri Lanka was positive by PCR for Burkholderia pseudomallei. That was the only thing that we had from that one farm was transport water, because there were no fish that arrived dead from that farm. So we didn't have any ability to do any work on the fish, and there were no swabs taken from any of the transport trays or anything that came from that particular farm. But we did have PCR evidence that it was positive for Burkholderia pseudomallei. However, despite our using of enrichment broth and all the techniques that our lab has to try to grow Burkholderia pseudomallei, we're not able to grow it from there. Next. So just in summary, we from the case investigation, this is the first documentation of transmission of Burkholderia pseudomallei from freshwater home aquarium to human. There have been prior reports, though, that have shown that it was in aquarium transport water. And we also know that there have been infections in marine animals, and it has been identified in tropical fish previously. The good news is that for the local store investigation, it did not appear that it had colonized any of the tanks in the pet store, and there was no evidence of transmission to the staff in the store. And from the vendor investigation, it did appear that ornamental fish supply chain could be a possible mode of dissemination of Burkholderia pseudomallei into the United States, and that we don't know if it was the fish that brought it in or if it was a transport water, but that's why we're saying that it could potentially be a zoonotic infection. And then in the spirit of One Health, this just demonstrates the importance of the epi and the lab, and looking at humans and animals and the environment to piece together this potential transmission. Next. Oh, well, I wanted to, I thought it was another slide so I could say acknowledgments, but I wanted to very much thank the Maryland Department of Health for their assistance on the ground with the investigation. And at the Los Angeles County Department of Health, I wanted to thank the Acute Communicable Disease, Environmental Health, the Public Health Laboratory, and the Veterinary Public Health units. Thank you. That ends the presentation.
Thank you, Dr. Bauer. Our final presentation, Chicken Chats, Focus Groups with Flock Owners, is by Lauren Galarza. Please begin when you're ready.
Thanks, Laura. Hi, everyone. Today we'll be discussing some focus groups conducted with backyard flock owners. Go ahead to the next slide. So first, I'd like to tell you a little more background about why we did focus groups with this population. So every year since the early 2000s, we've seen multi-state Salmonella outbreaks linked to contact with backyard poultry. So over the years, these numbers of illnesses and outbreaks has been increasing, with the last few years having around 1,000 cases, and notably in 2020, almost 2,000 illnesses. Next slide. So these outbreaks really require One Health collaboration efforts in order to make an impact. So we work to include animal health, public health, sellers at all different levels of the backyard poultry industry, as well as consumers when we're trying to share outbreak information across these groups, as well as prevention efforts. So everyone can really work together both during the acute outbreak phase as well as prevention phases to make an impact. Next slide. So, in response to this public health problem, CDC, along with partners over the years, have developed a suite of communication materials for flock owners. And up until recently, those materials had never been able to be formally tested to assess appeal and whether they meet flock owners' needs. When we look at literature, there's also relatively limited qualitative data on backyard poultry owners. And then when we look at our outbreak data, which is limited to people who are ill and becoming part of the outbreak, but as well as looking at social media, some of the images there on the right, we do see that people tend to engage in behaviors that could lead to infection. And for anyone who may not know, backyard poultry can carry Salmonella while they look healthy and clean. So you might end up with some cross-contamination occurring depending on how people are interacting with them. Next slide. So over the past year or so, we were able to work with a contract company to actually conduct some focus groups with backyard flock owners to look at their knowledge, attitudes, and behaviors around safe handling of backyard poultry, as well as actually getting some feedback and testing our existing communication materials. We were not able to test all of them, but we did select a few of them to show to participants. And we were able to actually implement 10 90-minute virtual focus groups with about 56 participants with around 4 to 6 people per group. Next slide. So I did want to note that I'm giving a very high-level overview of what we did and the results, and also wanted to note that focus groups are a relatively small sample size and not necessarily generalizable to the entire population, but they do provide really valuable feedback. So we used an online survey and recruited via websites, social media, and some partner listservs. And then we decided to segment our groups by risk level, flock size, and experience. As we hypothesized, there could be differences in handling practices, reasons for ownership, or other conversational differences. Next slide. But ultimately, we did not find significant differences among participants with their responses. In response to the survey, we did have a wide range of people owning backyard poultry. So we had, some as few as ownership for 5 months, with some having owned backyard poultry for more than 25 years. Some people had very small flocks, others had over 200 birds. Among these participants, the primary reasons or benefits for why they owned backyard poultry that were cited most often was fresh, better tasting, responsibly sourced eggs, educational purposes such as teaching children, as well as companionship. And their interactions with poultry, they were noted as very pet-like. Most of them had names. Most people were very physically affectionate, as were their children. And very few parents noted limiting any interactions with poultry. Most people kept them outdoors, but some did bring them indoors when the poultry were very young or during bad weather. Very few downsides were noted, but when there were downsides, it was mostly bird loss due to predation, sometimes some cost barriers, or other burdens, such as finding someone to take care of poultry in the event that they couldn't or were out of town. Next slide. When we looked at where people were looking for information, we had asked if they knew about health topics related to backyard poultry, and very few people reported that they sought information on human health topics. They were mostly looking for information about caring for their birds. There was a heavy reliance on online resources, so things like owner discussion groups on social media. They did note a healthy degree of skepticism, and some have even started their own online discussion groups or seek out groups where there is more expert advice, such as veterinarians being the one to answer questions in those groups. Although it was not used by many, the majority of participants did trust local and state agriculture and extension programs as a resource for backyard poultry materials. Again, most people trusted veterinarians as a reliable resource, but very few noted that they had access to a veterinarian who could treat poultry. And then while most did not know CDC or health departments had backyard poultry resources, they were still a trustworthy resource for health information overall. Next slide. When we looked at knowledge and awareness about Salmonella, the most frequently cited health risk associated with poultry that people could recall was Salmonella, and most were aware of the importance of hand washing and risks associated with kissing poultry, but most had more awareness about foodborne Salmonella infections and not as much about how the transmission dynamics work with poultry and people. And then most people tended to believe that their flocks and eggs were healthier and viewed commercial farms and larger businesses as the potential greater threat or source for infection as it related to Salmonella. Next slide. So in general, risk perceptions with Salmonella infection, participants overwhelmingly did not consider themselves or their children at risk for infection for a variety of reasons. And some of those are listed here on the slide, with most of them not really knowing either themselves or someone else who had been personally affected by this. They didn't really think that they posed any greater risk than any other animal. Some had believed that exposure might build immunity, and a lot of them did not find information on risks or outbreaks super relevant or compelling. However, most people did engage in certain behaviors that could help to prevent infection, such as hand washing, keeping coops clean, avoiding overcrowding, and cleaning eggs. Next slide. So looking at some of the materials we were able to show participants, some of the well-received materials are there on the right. They were seen as positive, supportive, and playful, clear and easy to understand. And there was overall general agreement with the messaging and the content, except there was less agreement around some of the messaging for small children and people over 65 when it related to handling birds. People also especially really liked photos of baby poultry more so than the animations. Next slide. Another well-received material was actually our advice section on the CDC website for an outbreak notice. It was seen as informative and helpful, especially the Salmonella symptom information for people. And again, there was overall agreement with some of the messages, but there was less agreement and a little bit more confusion around the advice to not wash eggs in water. No one really was willing to cook their eggs until firm, and no one really limited physical interactions with birds. Next slide. Some of the less well-received materials were the materials that included outbreak statistics or data. Those were seen as a bit scary or fear-mongering. Some thought the outbreak information was a little bit more harmful than helpful. And some people actually wanted more information on who exactly was affected by these outbreaks. And most preferred prevention messages with a more supportive or positive tone. Next slide. Throughout the focus groups, participants were able to ask questions, and some of the remaining questions that they had at the end, even after having seen some of the prevention materials, really seemed to center around how Salmonella happens in birds in the first place. Is there anything that can be done to prevent or treat it? And there was still some lingering questions around, how many illnesses and outbreaks are actually attributable to poultry, or was it just Salmonella overall? Next slide. So some of the things that we've learned and some of the next steps we're going to take here at CDC are really thinking more about a holistic strategic approach to our communications, really trying to be more audience-centric, message-driven, and digital first, since most people are looking for things online. Try to position ourselves as a partner to flock owners, provide that positive reinforcement, consider a harm reduction perspective, also add some more poultry information online about how you can reduce poultry or Salmonella in poultry, as well as enhancing some of our existing partnerships and creating new ones. Next slide. So one thing that the contract company who provided us was this really helpful table that I thought others might appreciate to really think about your planning when you're doing material and message development, and really trying to answer these questions to have the biggest impact with your materials. Next slide. So that has our team's contact information if you have any questions or want to reach out about partnering. But with that, back to the hosts of the call.
Thank you. Next slide, please. Thanks to all of today's speakers for their informative presentations. Links to resources from each presentation are available on our website at cdc.gov/onehealth/2022/february.html. We do have time for maybe just one or two questions. We're approaching the top of the hour. So I'll start with a question for Dr. Chow. Do you have plans and funding to sample other sites?
Thanks. Right now, we don't have current plans, and I think
Dr. Chow, you're a little bit quiet.
Oh, thanks. Got my microphone now. Can you hear me? Yes. Right now, we don't have current plans, but what we'd like to do is work with other partners in state departments, academic groups to accomplish things like that. And so our group, the Mycotic Diseases Branch at CDC, is trying to actively think through how we can promote those types of activities. But we ourselves don't have plans to go and do sampling quite like that in the next year. Thanks.
Thank you. And for Dr. Bauer, can you answer this question? Can infected people or animals contaminate soil with Bulgaria, spreading it to new areas?
Yes, that is actually, I mean, it is endemic in the soil in several countries in the world, and mostly in the middle latitudes in Southeast Asia, Northern Australia. That is something that we are actually concerned with because the soil conditions and the climate are appropriate in the United States for Burkholderia pseudomallei to live in the soil. We just have not found it in the soil yet here. However, there have been cases of people in the patients in the United States that have never traveled to an endemic country. And when you look at their isolate, it matches other North American strains, meaning that they are from Mexico or the Caribbean, since we haven't actually found one in the US. But so that makes us think that it may actually be in the soil in the US. We just haven't found it yet. But yes, if it were to, it is potentially it could become established in the soil and water in the US. Over.
Thank you. And I apologize, we're at the top of the hour, so we can't get to any other questions. But if you do have other questions for today's presenters, we've included their email addresses on this slide on the ZOHU call webpage for today's webinar and in today's email newsletter. A video of today's webinar will be posted within 30 days. Next slide. So please join us for the next ZOHU call on March 2nd. Thank you all for your participation, and this ends today's webinar.